Hello, my name is Dr. Hillel Mazansky and I'm coming to you today from La Jolla, California. My specialty being guided imagery or guided visualization, medical hypnosis, nutrition and exercise. How to live a longer, happier, healthier life is my mantra. My website is drmedicalhypnosis.com, drmedicalhypnosis.com, for your personal health hypnosis videos. Today we are going to discuss chronic pain with all its implications. Chronic pain is described as a persistent, unrelenting pain that lasts for 3 months or more. The vast majority of the causes of chronic pain are fibromyalgia, irritable bowel syndrome or IBS, menstrual cramps, migraine headaches, arthritis, chronic neck and back pain. Those are the most important that cause people chronic pain. So if you do have chronic pain, what do you do about it? Well, my suggestion is first to go to your healthcare provider and let she or he work you up completely and find out what the cause is. And they will give you the appropriate treatments. However, these treatments usually, once the pain is chronic, patient is given narcotics such as Oxy, Percocets, Percodans, etc. All these medications have their side effects, and the side effects can lead to medication can lead to addiction, because all those narcotic pills are high in addiction. Associated with the chronic pain, depression develops, and the depression aggravates the pain, and as the pain is aggravated, so the depression is aggravated. So it's sort of a vicious cycle. People suffering chronic pain also have great difficulty in sleeping. They become insomniacs. Now look at this type of syndrome: insomnia, chronic pain, depression. And the allopathic physicians will prescribe multiple medications, all of which have side effects. The main side effect, however, is that patients can become addicted to these narcotics, needing increasing doses. And if that doesn't work, they go to a higher level of medication. All these medications have side effects. And that also aggravates the condition of chronic pain. Being a holistic physician, I feel we can treat the chronic pain holistically, empowering yourself to be able to treat yourself using hypnosis, nutrition, and exercise. The treatment for chronic pain, number one, is exercise, exercise, exercise. And then patients say, well, they can't because they get what is called secondary gains from their pain. That means that as a result of the pain, their partners treat them carefully and pay them more attention, and the family members pay them more attention. So this is called a secondary gain as a result of the chronic pain. So exercise helps a great deal. Now, if you've never exercised before, start off just walking. You don't have to go to a gym, just walk. And then every 3 or 4 days you increase the distance And once your distance has been accomplished, eventually it should be an hour, then you start walking more at a greater pace. And again, you do that slowly, first 5 or 10 minutes, and then for a few days later, another 5 minutes, and so on and so forth. So you gradually increase it. Now, why is exercise so important? Because exercise excretes endorphins, the feel-good hormone, which improves your pain. Nutrition, as far as nutrition is concerned, a highly nutritious diet or nutritional program is advisable. However, we know that in migraine sufferers, there are certain foods that contain tyramine, such as bananas and avocado and red wine. All these can be triggers for migraine headaches. So we ask our migraine patients to make a list of what they've eaten, and when they get a headache, we can more or less analyze the causative factor and remove that, and that sometimes does improve the frequency and the intensity of the pain in migraines. Fibromyalgia is a chronic, unrelenting pain over approximately 18 parts of the body. Those suffering fibromyalgia also develop chronic pain with depression, etc. Irritable bowel syndrome, or IBS, also chronic ongoing pain in the lower abdomen, and the cause of that is unknown, but it does come more among females than males, and there is a psychological component to that. Menstrual cramps, although they develop once a month and the rest of the time the patients are pain-free, but still, why should you endure the pain of IBS? Menstrual cramps, another cause. There is also chronic pain associated with neck and back pain, with injuries, and sometimes, often we've seen with multiple surgeries, especially related to the lower back. These are the most common causes of chronic pain. How the chronic pain works is that signals are sent from the peripheral nerves, the distant nerves over your whole body. They are sent, those signals, to the brain, and that causes the ongoing pain. So now you have an idea of the causes. Let's begin with treatment. As I said, exercise is very good. A good nutrition program is always good. Then the ultimate, from our point of view, is medical hypnosis, because we've been able to see in our patients, chronic pain patients, how well hypnosis works. To receive those, the pain reduction for chronic pain video, you're invited to go to my website, drmedicalhypnosis.com. drmedicalhypnosis.com, and then you can select your video for chronic pain, menstrual cramps, they're all there. What else besides hypnosis? Yoga can help sometimes. Acupuncture can help sometimes. And those people who have such intense pain, who have not used one of these, what we call mind-body techniques, they refer to pain specialists. And some of them do non-invasive operative procedure called the radio frequency ablation. And that is using radio waves. The nerves are sort of burnt, and the pain relieves itself. But you cannot do that for fibromyalgia pain because the pain is all over. IBS, not really, because it's a large area to treat. But it does work with chronic neck and back pain, with arthritis setting in, etc. I think I have been able to give you all an overview of what causes are of chronic pain and how to treat them. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.